People are increasingly looking to 2015, when the initial targets for the Millennium Goals are supposed to be achieved, and now they're beginning to look beyond them. And we've just produced a report on chronic poverty, which relates to this debate. The report is quite forward-looking. It suggests that, of course, we know that there are going to be a lot of people still in poverty by the time 2015 comes around. But some of those we know are going to be chronically poor. Now, what does that mean? That means that they've been in poverty for a long time. They're trapped in poverty. They're very insecure. They may not have very effective citizenship and so on. And by all accounts, they're going to continue, and their children will probably remain in poverty for some time. So there's quite a large proportion, possibly up to half, of those who are expected to remain in poverty in 2015 will be chronically poor for a very long time. The report tries to look not at the problem so much as the solutions. What can we do? And what can we do now, as well as what can we do beyond 2015? And there are several things that we can do. Chief amongst which is to provide social protection, and particularly basic forms of social assistance, to as many of the poor as we can. And this is not only for the chronically poor, but it's for people who are possibly not poor, not entirely poor or absolutely poor at the moment, but are at risk of becoming poor. So they're vulnerable. So it's to prevent people from becoming poor, as well as to help people out of poverty. In addition to social protection, there are some very important human development services, in particular post-primary education and reproductive health services, which we feature in this report as being absolutely vital and neglected. The world has focused a long time on primary education, and now it's time to turn to post-primary for all sorts of reasons, but that is an absolute key thing to get the next generation out of poverty. The reproductive health services is particularly important so that families can control their family size. They can decide how many children they want to have when, and it's particularly important for women and for their health and autonomy. And that's a service which has been very controversial, has been opposed by some. There is now a Millennium Development Goal target focusing on that service and giving universal access to that service, and it's going to be really important that we put a lot of effort into implementing that. And the report has other similar practical recommendations which are doable and which can be financed. And what's really needed then is the political will to implement those. Now, how do we hope that the report will be used? We obviously hope to make a contribution to the debate going on at international level. There are meetings to review the Millennium Development Goals in New York in September. We'd like to contribute to those. There are discussions about the financing of development in Doha later on in the year. But more than that, we would like the report to be useful to national policymakers. And the next contribution in this series will be a national policymaker reflecting on how useful the ideas produced by the Chronic Poverty Research Centre, and in particular the series of chronic poverty reports, which now include some national reports as well as the international reports, are useful in that context.
The chronic poverty report is very important because it has identified the policy recommendations which resonate with what we think are the key interventions for addressing chronic poverty. So the 5 solutions of social protection, public service to the hard to reach, gender empowerment, building assets of the poor, and strategic migration and urbanization are key areas which we think something can be done about them. And if I take an example of social protection in Uganda, we think it should be done and can be done, but the report has given us a shot in the hand in terms of giving us encouragement as to what we should do and what we must do because of the lessons learned from other countries. Most of our governments need to learn lessons on what works and where it works. And this report has done exactly that by showing us what can work and the context under which it works, which is really very important for policymakers in terms of adopting the relevant policy options. So on my part, we shall be using this information from the report in terms of informing our National Development Plan that we are designing. And we shall try to look at the kind of priorities that we are set in that plan to include some of the areas, for example, social protection, to be a key area for intervention for the government.
I think that report is very timely because this is the midpoint for the Millennium Development Goals, and on the 25th of September we are having a very big high-level event at the UN in New York, and we have many heads of state, civil society leaders, etc. coming there to discuss how we have performed in the first half and how we need to learn from those mistakes and successes. And I think the report will make a very important contribution as we chart the course for the second half. I think there are many things about the report which I think are very valuable as we look ahead. And one of the unique factors of the report is that it looks at the issues from the lens of poor people themselves, which is very different from many of the reports which have come out on the Millennium Development Goals and poverty, which are looking sort of outside in. This is looking inside out, and I think very valuable insights which simply emerge from that methodology itself.